Now, some of the questions are not always related. In this case, the follow-up question asks, which of the following patients are eligible to receive nitroglycerin spray? Patient have no IV access and you and your partner are not IV certified. Choice number 1, a 52 years old patient present with chest pain, crackles on auscultation, and ECG showing ST elevation in lead V4R. Choice number 2, a 45 years old patient with history of heart failure, now has crackles on chest auscultation, pallor and sweating, blood pressure is 88/62. Stated he has used the drug before. Choice number 3, a 57 years old patient with history of heart failure, now has crackles on auscultation, blood pressure is 148/92, and he stated he has not used the medication in the past. Choice number 4, a 64 years old patient with chest pain with background of diabetes and hypertension, now with wheezing on chest auscultation, blood pressure is 138/92, and he stated he has used the drug in the past and took Cialis pills about 26 hours ago. And choice number 5, a 55 years old patient with chest pain, OPQRST positive with anginotic pain, status post-MI, clear auscultation throughout, ECG reveals 1 mm ST elevations in septal leads. Patient already received 3 nitroglycerin sprays, 0.4 mg each. Now remember to use your active reading skills during the first read of this question. You don't have time to read it again. And put an underline under the relevant information. I'm going to use marker just to make it more convenient for you, but remember to use your pen. And if you can, even use a pencil, because this is what you're going to use in the test. So try to make sure everything you do will prep you for the test. In choice number 1, ST elevation in lead V4R indicate right side MI. In this case, nitroglycerin is contraindicated. This eliminates option E. In option number 2, the patient is hypotensive. Let's eliminate option A. Now you can see that option B, C, and D all share number 3. So option number 3 is probably true. We can skip to option number 4. In option number 4, the patient took phosphodiesterase inhibitor in the last 48 hours. This leaves us with only B and D. Now we have to decide if option number 5 is correct. In option 5, the patient already took 3 puffs of nitroglycerin. Now, the distraction here is that the patient is not really STEMI, because it's only ST elevation of 1 mm in V123. Therefore, the patient can take up to 6 puffs and he is eligible to nitro.